just, I think,
Back when I used to do radio, it was here.
right, you're not getting,
I tried to say that, but, yeah.
right, you're not,
So we don't have to bridge out one.
right, so do, right. Or your car is driving you home, and, from a safety standpoint, that's a good thing.
You know,
We're asking the one that Kristen ran into, my wife, her new job. She's the assistant manager, regional manager, DMV. The Amish, we did the new fix, yeah. Well, they said Kristen told me, said the problem is they do the code section, but in that 18 to 20, I guess it would be, because 21's a different. Yeah, so 20, and below that's okay. There's a description of what the picture has to look like. And it's like, code says this is the picture. It has to be on.
seems like the other part of it.
But you got to cut. Yeah.
Strictly here as the code is.
Yeah, why do they care now? Because they want to do it.
I'll tell you, she's learned a lot in the short time she's been there, because she knows, like, because she'll ask me, what did you guys intend in the legislature? This is intent. I say, well, it's not the way they're interpreting it. And that's one of the biggest things.
The chairs weren't just like,
Well, I think he's not sure what he's going to be doing, so he's working. He's not taking time off of work, from my understanding.
Welcome to, by all means, it's just 12 of us.
That's
Well,
good.
he was his abuse. I mean, not all of it. He's a farmer. Oh, heck yeah, very busy man. Pigs, chickens, and cows. Bad. Well, at my house, there's 10 babies on the way, and 40 on the other side of Taylor County, like an hour away. Dad's farm, which is 83 silver and a lot out there now. Yes. All of the meat, yeah. We do butcher our own.
This was a me this morning asking about the homestead exemption. Homestead exemption. I've been thinking about it. I still think that constitutional amendment I had is the best way to do that, because nobody gets hurt. What I say is when you hit between 62 and 65, that's what's done every 3 years. When you hit that, we just lock it. We don't change the assessment until you either sell the property or pass on. That way, your property tax is up to the level. Doesn't hurt the counties because they don't take an initial hit. They get slower growth, so the actual real tables catch back up. So you get a curve that kind of looks like this.
Because this year,
So when you hit between that assessment they do between 62 and 65, we say that is locked until you pass away or sell the property. Owns the property.
people live too cheap for the youngest person.
It'd be whoever qualifies for homestead exemption now. We don't change that, because it's like my wife now is going to have that issue, but she's so much younger than that. I don't know if it's how that works, but whatever it is, we just keep it the same. And if you move into the state at age 70, say, whatever you purchase that, it just locks.
We have a big crew that's still out at the power plant.
That's fine, we're gonna begin, we do not have a quorum, so we won't vote, we'll just begin. Quorum arrives, we'll vote, if not, we'll move on.
But
All right, folks, good afternoon. We'll go ahead and call today's meeting to order. It is after 4 p.m., so today's Joint Committee on Government and Finance will be in order. Chair notes at this moment, we do not yet have a quorum of the committee present, so we will forego approval of the minutes of our last meeting until a quorum arrives later in the meeting. But I do want us to go ahead and begin with our presentation today. We have Mr. James Fawcett, President of Highmark, West Virginia. We are here in Parkersburg, where Highmark is situated, and it seems entirely appropriate that we invite Mr. Fawcett and his team to share with us some thoughts on their business.
Terrific. Thank you, and welcome to our home. We're so delighted you're here. My name is Jim Fawcett, as you heard, and I've been with the company for 36 years, and this October 1 will be my 8th year as president of Highmark, West Virginia. So this really is a discussion. Being from Blue Cross Blue Shield, largely going to look at the private commercial markets. We'll delve a little bit into some of the government ones. But again, so delighted to have you here today. Who is Highmark, West Virginia? I thought I'd just start with this. We are the only insurance carrier in the state of West Virginia that can serve West Virginians in all 55 counties, no matter what their commercial needs are. We can do Medicaid, individual ACA, small group, large group, Medicare Advantage, Medicare Sup, dental, vision. We're there in all 55 counties offering insured products. There are over 600 Highmark employees that call West Virginia home. So we obviously have an important economic impact as an employer in addition to this being our home. We have roots that go back over 80 years in West Virginia, and we are a not-for-profit company. And we are very proud and work very hard to be the #1 commercial health insurer in the state of West Virginia. Can I take a minute and digress a little bit, because sometimes there's confusion about what is Blue Cross Blue Shield. I just don't want to assume that everybody knows what Blue Cross Blue Shield is. Blue Cross Blue Shield is our global association that has 33 independent licensees. But the importance of that is 1 in 3 Americans carry a Blue Cross Blue Shield card. It's very important in the economics that drive insurance. And more importantly to our customers, through the association in all states across America, we dovetail and share each other's provider contracts. So if you're traveling on vacation and you're in Florida, Carolinas, if your child decides to go play basketball in another state, or if you're a business owner who has locations outside of West Virginia, we can allow seamless access to any provider, be it hospital, doctor, or other providers, to ensure that you get that excellent experience of acceptance and the best price that you can for the services that your employee's child, loved one needs. Also worth noting, when you think about the employment structure of West Virginia, Blue Cross Blue Shield serves over 5.6 million federal employees. And it's our largest customer too. So if that's the national, who is Blue Cross Blue Shield Association? That's the association. There are 33 licensees. Highmark Health is the regional licensee who we're part of that family. Highmark Health is the 5th largest Blue Cross Blue Shield organization. It is all not-for-profit at the Blues. It's the Blues in New York, Pennsylvania, Delaware, and West Virginia. Importantly for us in serving our members, we get to share scale. And technology on the insurance side of the business, scale is incredibly important. We have scale that we share over 29 million lives through our parent company. And I'll be very candid. Earlier I said we're here at all products to all West Virginians. Without that scale of Highmark Health, we could never be in all markets for all West Virginians. There are over 42,000 employees that work at Highmark Health. We have dental companies, vision companies, stop-loss reinsurance companies. We also have a health system in Western Pennsylvania called Allegheny Health Network, which makes our strategic planning meetings very interesting. So that's Highmark Health, $26 billion in revenue. Highmark, West Virginia is headquartered right here in Parkersburg. Beautiful building. I hope you walk up the street and see us. Feel free to use the tables out front. We've been serving through our predecessor companies, West Virginians, for over 80 years. Linda Weigel, our head of sales back there, if you raise your hand, she has a 98% client retention rate over the last 5 years. We work really hard to keep our customers delighted. It's very competitive year after year. Thank you, Linda. Our service is obviously done here in West Virginia. And the important in this meeting is when we make money as a not-for-profit, bottom line money, that money stays in West Virginia. It goes to our risk-based capital. Yes, we buy services from Highmark Health, legal services, administrative services, clinical, network services, but when we make money here in West Virginia, it stays here in West Virginia. So we have the National Blues, we have a regional health system, and then we have Highmark, West Virginia, right up the street. We also worry about our corporate community citizenship. Are we good to the communities we serve? And 3 years ago, we started a charitable fund for health, a foundation. And I'm going to touch on this a little bit later, but in our first 3 years, we've granted out over $6 million to not-for-profit agencies who are helping West Virginians in all 55 counties around healthcare access, quality issues, things like that. So I know we're talking about finance, and when you talk about healthcare, we have people that come to work every day to address issues of rural access. I mean, that is an issue that you have to face when you're in West Virginia. Issues around transportation, housing, healthy food, substance use disorders, chronic and lifestyle issues around obesity, tobacco use, mental health, substance use disorders, and the workforce reality that we're in a state that our general population dynamics is aging and it's declining at the same time, which creates real workforce challenges, not just for us, but for the employers we serve. I'm not going to go deep into those issues today. I need to acknowledge those because those are significant drivers in healthcare. Knowing who's your roles in our public policy, I kind of wanted to go focus on a couple of other things. So I always start off with the Insurance Commissioner's annual report. I guarantee you I'm the first one who goes out online to read this thing. I live by this thing. I love this report. Not every state does this. We count belly buttons in our business. How many belly buttons do we insure? When you ask my boss, am I doing good or bad? It's how many belly buttons am I insuring? That's a measure. And this is kind of a source of truth. It's important to see from the Insurance Commissioner's Live, and a couple takeaways. We have 1.7 million people in our state. We're not a large state. And you can see this is the way that West Virginians are covered, which drives the economic reimbursement back through the system, either to health insurers like myself or to health systems when you think about our 3 major health systems or the FQHCs in our state. This is a really important model. And so the first thing that I take away from this is that 74% of all West Virginians are covered by a plan or have no insurance that end up reimbursing our health system providers. These are the big health systems, individual, whatever, on government-based reimbursement. Yes, PEIA just went from Medicare to Medicare plus 10%, but still in a relative perception. A lot of people are paying it, Medicaid rates are lower. Because we're West Virginians, we don't realize that maybe just one state over, like one state north of us, where Highmark Health is headquartered, if you looked at payer mix rates, it would be like 55, 60% commercial, not government. This is a major, major challenge for all of us. Now, this is my artwork taking the state's report. And this is kind of, when I look at the economic driving forces behind supporting our health systems, when you have 74% that are government, a couple things that happen. One is difficult payer mix. That's why we don't see a lot of competition in our state as compared to other states with health systems. We're rural. But also, you see this enormous cost shift to the commercial industries. So there are states where you might hear that, the hospital inpatient, outpatient reimbursements, 250% of Medicare, just using it as a national standard. In West Virginia, it's not uncommon for Medicare for our commercial hospital rates to be 300, 400, 500% plus of Medicare rates. And it has a long history going back in time why they exist. But to be candid, without this important segment of the market, our health systems wouldn't survive. And it just is an incredibly difficult economic challenge for us to deal with. The other thing that I'd like to get into, and this gets a little complicated, I apologize, but I want to look at that 26% that was commercial, because that's kind of where I spend my time. So if you look at the green chart on the left, that big piece of the pie, I wanted to break out, when we all hear markets, that little yellow sliver, that 1% represents all the West Virginians that are in individual policies. We're highly regulated both federally and state. That 1% are individual policies. That 2% is the insured small group market. And this is the states. This isn't necessarily Highmark share. This is how I'm going through the state. 7% is large group, and that means they have an average number of employees of 51 plus. That is fully insured, that's 7. And then that's 16%. Those are ASO, administrative services, sometimes called ERISA preempted or ERISA exempt. Those are self-funded plans. So the one takeaway that I've seen when I watch you all doing public policy is when a new piece of legislation is passed or a new mandate is passed, and if it applies only to commercial policy holders, I just want you all to be realizing all that effort you did is only impacting 10% of the belly buttons in West Virginia. So as the one who hears firsthand about the cost of healthcare, and what I love about West Virginia's legislature is you all have private jobs, and you're involved, either you're business owners or executives in your business, as you understand how this works. So you kind of get the cost shifting to commercial because of the payer mix on the prior slide. And then when mandates come in, and even if they add just small little pieces, over time, our commercial customers, our commercial policyholders bear a lot of that weight. And that's just how it works. When I go over to the other piece of the pie, now I'm saying, well, let's just look at the commercial markets. So this is a percent. So individual makes up 5%, small group is 6%, 29% is the large group fully insured. If you look at that big dark blue piece, that is West Virginians who are covered by a self-funded plan. And when I say self-funded plan, that means there's no insurance, there's no oversight by the OIC. They're usually claiming ERISA preemption or ERISA exemption. The scary part of that is over half of those people are in plans where the decision makers are out of state. Think of Walmart, think of Kroger's, quite frankly, think of Nucor, Toyota. The decision makers who make those plan decisions are in other states. So a lot of times we as West Virginians don't necessarily have access to those key decision makers. So that's kind of what I want you to understand looking from this, that again, 10% get the impact of mandates that only apply to commercially insured, and that in many instances, the fastest growing market in the commercial markets is self-insured. They don't follow state mandates, and often decision makers are out of state. I'm going to digress a little bit into individual policies because these are important, and I think when you hear my final comment, you'll understand why I want to focus about this. Let's go to the blue chart to the right. The bars, those are the belly buttons. How many West Virginians have coverage with the exchange individual products? So you can see the start line. This is the past 5 years. You can see there are 20,000 West Virginians in our individual markets. And as you go up to 2024, you can see that goes up to 51,000 people. The line bar with the numbers above it, with the way individual premiums work, there's an advanced premium tax credit that many participants get. And so we look at what's the average amount of the price, the actual amount of money that an individual on average has to pay for these coverages. And you can see from 2020 to 2024, it has gone to a high of $323 to currently it's $118. So a couple of factoids that I would like you all to know that what we look at. And that first one is over half the West Virginians on the individual market are actually enrolled in plans that cost them less than $10 a month, over half, so of the 50,000. 2/3 of the West Virginians who earn 200% of the federal poverty level, and I apologize, I just realized now I have two acronyms in there without that. APTC is Advanced Premium Tax Credit, and FPL is Federal Poverty Level. But 2/3 of West Virginians who are in these individual markets who earn below 200%. That means they earn too much to be eligible for Medicaid, but they're certainly the working poor. These guys are really struggling. These individuals are often eligible for plans that cost less than $50 a month. And in fact, because of the way the exchanges work, where you can choose between bronze, silver, gold, different policies, that over half of them could actually get good coverage for $0 a month. And as we talked about the economics of these plans, remember, these plans are reimbursing our health systems at commercial rates, not at government rates. So it's a win for them to have these coverages, plus the reimbursement to our health systems as commercial. It's worth noting on that fourth bullet there that West Virginia, as published by CMS, had the largest individual growth rate of any state in the United States from 23 to 24. Of course, that's a percentage, not raw number, but we had the most growth. And why do I bring all this up? Lying ahead to us is a very big change that's going to happen federally. And that is that the current advanced premium tax credits that enable this all to happen, which is good for West Virginians, as it sits right now, will sunset on 12/31 of 25. So we as a community have to have plans on how we manage that. And of course, the feds are going to make those decisions, and the election this fall is going to have everything in the world to do with it. So a very important segment of the commercial markets, even though it's 1% of total. So as the largest commercial insurer, are we fair to our customers? Are we efficient? And this is based on our 2023 filing with the OAC. This is how our premium dollar in global is spent. 49 cents of the dollar is spent on facility reimbursements, and you can see the breakout there between inpatient and outpatient. 13% goes to physician reimbursement. 28 cents goes to prescription and specialty drug. I do want to clarify that the drug spent in that 28% can be a combination of what you might get from your local pharmacy. It could be pharmaceuticals that were administered to you in an inpatient setting. It could be pharmaceuticals infused in an outpatient center or in a physician's. We bucketed it there for the reason that the single fastest and largest driver of all healthcare costs across the country now is pharmacy. I told you I've been in the business for 36 years. When I started 36 years ago, it was all about inpatient care. How are we going to keep people out of the hospital? Maternity deliveries were taking 7 days, consuming all these resources. You fast forward today, it's almost unfathomable to me, and again, this is primarily commercial population, that we now spend more on pharmacy than we do on inpatient care. And then finally, administrative cost. Everything that Highmark does is captured in that 10% admin. Our margin is posted as well in our filing, so in that 10%, our margin was 1.8%. So we do believe we are efficient and a very judicious spender of our customers' premium. Are we a good corporate citizen? So we created this charitable fund for health, a true foundation, 3 years ago. In our first 6 years, we have already spent grants. We've issued grants, a total of $6 million. You can kind of see the high-level focus there: oral health, social determinants of health, et cetera. Every quarter, we publish a list of grantee recipients. This just happens to be the 2024, I think it was Q2, so you may know that. Our independent fund advisors will accept grants from any eligible organization. They openly prioritize a rich mixture of both large organizations as well as tiny organizations, and they're really focused on maximum impact on all 55 counties. Which as a traditional commercial insurer is wonderful, because so much of the needs in the southern part of our state, and without a customer base down there, this has really helped us fill the gap. Just as one example, and this example is, I want to highlight a couple things, but we supported WVU Medicine and their Food for Mountaineers program, as well as Vandalia Health and Marshall Health with their Healthy Neighborhood program. This roughly is a $2.5 million support program over the next 3 years. And what this does is give the power of the pen to the frontline clinician who's dealing with the family who's really suffering from food insecurities. And if they're struggling with food insecurities and they have a condition like diabetes or something where a good diet would really be a fantastic way of helping their total health, they can write a script and it results in a debit card being issued, an amount of $75 a month up to $150 a month that can be spent at Dollar General, Kroger's, or Walmart on healthier for you foods. So you can't go there and buy soda pop and Twinkies, but if you go there for fresh vegetables, and for anybody paying attention to Dollar Generals, they are upgrading some of their stores to have fresh fruits and vegetables. This is part of the scheme, the idea of helping them out to do that. But the idea is the clinician identifies those who need the help. You arm them not with just the frontline clinical help, but with either social workers or dietitians who are affiliated with the local health systems. And we're hoping that this has a good enough impact, because the big challenge in all these programs is sustainability, because you can't just do this through grant giving forever. But the hope is that this will be a large enough population. I know the Healthy Neighborhood's already up to, I think, about 500 or 600 individuals right now getting help, that we can then study them and see what was the outcome. Total healthcare cost, did it come down? Quality of life indices, did they go up? What is this? If it's measurable, then we can either find additional funding or maybe even find a way of including that in the medical loss ratios for the MCOs. Who knows? But very proud of that. It's a great way of doing things differently for connecting our foundation with these important health systems. So I've talked a lot about commercial. I do want to introduce Jason Landers, because we just, for the first time ever, have a Blue Cross Blue Shield option for Medicaid. Jason?
Thanks, Jim. Thanks for giving me a little bit of your time as well. Just a couple of quick thoughts before I run in. A little more than about 2 years ago, I came back to Highmark, and it was a big thing for me. And the reason I came back was specifically because I had some discussions about the opportunity to participate in the Medicaid space. It was really important to me. Just a note, I am a lifelong West Virginian. I'm a coal miner's kid, Dr. Kubo. It's near and dear to my heart. And as such, where I grew up, it was I always describe my existence as always on the brink of disaster, like you just don't know. And so anyway, this is a segment of population that really I consider my family. So that's what drew me back, and we spent a couple of years creating a plan, standing it up from scratch, and now we have Highmark Health Options, Blue Cross and Blue Shield. It's the first time ever that West Virginians with Medicaid can walk into a provider's office with Blue Cross and Blue Shield card. It means something to me because when I was a kid, that was kind of the standard bearer for quality, and that was actually, I believe, probably my first question to Jim and others when they were talking about doing a Blue Cross plan. One was, how is this ACA thing going? And two, is it going to be Blue branded? Because I see really an opportunity for those members that can graduate, let's call it graduate, that's probably a better term, from Medicaid into an ACA plan and then beyond. So I'll just mention our tagline that is on there, Medicaid that goes beyond care. Just pay attention to that. I'll come back to it in a little bit. But we were an option beginning August 1st. I guess technically right now I'm the fastest growing MCO in the state of West Virginia. We went from 860 members the first month to a couple of thousand the second month. So if I do the math, Southern West Virginia math, that's about 130% growth, something like that. So dubious honor, but it's an honor. But it truly is an honor for me to be in this population. So a couple of things. I mentioned that we spent a couple of years doing this. We really spent a lot of time really just talking about what we want to do in the Medicaid space and developing win themes and what our company is going to look like from a philosophical standpoint. The second thing we had to do over that 2 years was we stood up a real multi-state Medicaid platform. Highmark Government Markets serves well over 500,000 members in our footprint in the government space, Medicaid, DSNP, LTSS, all lines of business, CHIP. And what we've done here in West Virginia is selected the best of the best platform for claims, for clinical management, for everything, and brought them all together as kind of the cutting-edge multi-state platform here in West Virginia. We chose a real government-powered program called Health Rules Payer. We call it HRP. That is our operations system, and then Guiding Care, which is also a Health Edge product, and it is state-of-the-art clinical platform used by a lot of Medicaid plans. So really, we took the best of the best and brought it to West Virginia, which is very exciting for me. And if you look back on the history at Highmark in the Medicaid space by itself, they've been in that space managing these 500,000 lives for well over 30 years, 3 decades. That's generations of knowledge that we are really bringing into West Virginia to help us manage that segment of this spend in a more productive way. Again, Jim said that you guys are here for finance. We all know Medicaid is the lion's share of spend. That is a big spend that we have, and so we want to be, just as Jim talked about being good stewards of premium, our premium comes from the state of West Virginia, and we want to be good stewards of that. I said we put together win themes. These are just sound bites that really we try to live by every single day. And I just want to say them. We want to be West Virginia. I am a West Virginian. It's important to me. We want to be accountable. We want to be accountable to the state of West Virginia and our members. And we want to be experts. That's why we really spent the time to develop a plan that we thought we could win with. These are things that we talk about in every single meeting, and they're not just words. We live every single one of these. Our experience here in West Virginia allows us to really understand the market dynamics that drive healthcare in the state. I mean, Jim's spent a lot of time talking about what the exact breakdown of care looks like. So we have a ton of expertise that we bring. And again, we want to hold ourselves accountable to the provider community, to our members, and to the state of West Virginia. One of the things that I thought was important when I came back was I want to be West Virginia first, and that is something that I talk about in Highmark all the time. They joke occasionally that I am West Virginia, and I feel like that. I just ran a little trivia contest on the first residents in West Virginia, the Pringle brothers in the Pringle Tree in Buchanan, West Virginia. I'm a West Virginia history nut, so I love stuff like that. But they always kid that I am West Virginia, and it became important to me to have a West Virginia first priority in everything we do in this. And so as we stood this thing up, we hired all of our key staff. They're all now in place. We have our last hire that begins, ironically, she is going to get her West Virginia license at the next board meeting of the West Virginia Board of Medicine, which I think is November 4th. So she'll start on November 4th. But they're all people that are here and live here in West Virginia. That is a requirement of the state, and it's a requirement of me. And we took it one step further and developed a West Virginia first hiring program that as we grow, every incremental job, we can be in any place in the world, and the world has changed quite a bit, where things like operations, claims. Those things can be done anywhere in the world, but what we're doing is we've adopted this West Virginia first hiring so that West Virginians get preference in every job. We want our dollars to stay here in West Virginia as we deliver care to West Virginians. And I mentioned our tagline, we go beyond care, and I just wanted to take a moment to talk about what that means to us. It really means, as I've said repeatedly, putting our West Virginia citizens first. We think about what it means to be a West Virginian. I was just on a clinical discussion today about delivering cardiac rehab services remotely because I have so many places where there is no way that a Medicaid person could actually make it into a clinical, a facility setting to receive those services. So we're looking at ways that we can take our care, take our services to where the members are. Going beyond care really means not only empowering our members to be healthy. You know, every health plan makes sure that our kids are getting immunized on schedule, they're seeing their doctor appropriately, all of those scheduled events that we have throughout life. And I'm at the other end. I'm not a kid anymore, but I still have my schedule of events that I go. But again, as a West Virginian, it also means going beyond that. We are identifying opportunities to assist our members with opportunities to re-enter the West Virginia workforce when it's possible. It's not always possible. Our SSI population obviously have challenges that have to be met, but our aim is to overcome that notion of West Virginia fatalism that keeps people from entering the workforce. I have the benefit, I've spent the last almost 10 years as a board member on the local college here, West Virginia University of Parkersburg, and I've said a lot that we need to talk to our members about the opportunities that exist that are attainable for them. And through partnerships with our community colleges, I tell people all the time that you give me a person and 1 year of their life, I can teach them to be a welder and they'll make more money than I will in a year. And that's an achievement, and that really kind of breaks that bond of kind of just fatalism. It's never going to get better. We have to show people that there are opportunities. So as we speak to our members, we are looking for all of those opportunities. And then really, finally, the final thing it means to go beyond care is, you know, I've talked about our 80 years of West Virginia history, our 30 years in the Medicaid environment, and all of this experience that we've gained really effectively raising the health care and the opportunities for other people and offering them to the state of West Virginia as a font of kind of institutional knowledge that we've gained over this period, and how can we adapt this to make it work for West Virginia. One of the things in our footprint is in our Delaware footprint, we actually work on reentry of incarcerated members back into the population. We follow them through their incarceration time, and then as they leave incarceration, we make our first contact with them before they ever walk out. That is probably the most critical time, and we connect them with resources, and the aim is to keep them sober and on the path to a better life. And so we spent a lot of time taking those key elements of reentry and talking about ways that we can push those not only to the incarcerated population, but I always view the substance use population as another form of reentry. They really need to find ways to find that goal get assistance from us just in terms of, hey, here are the opportunities out there. We would like to talk to you about them, and enabling our people to make good decisions. So I think that's all I had, but I did want to thank you guys again for giving me a chance to talk about something that I'm very passionate about.
Thank you. So in closing, we're proud to be Parkersburg, we're proud to be West Virginia, and we are committed to serving all West Virginians for any of their health insurance needs in all 55 counties. I thought it'd be fair to share our mission, and that's to create a remarkable health experience, freeing people to be their best. You know, I always, every mission statement, there's always a word or something that grabs you. For me, whether it's been parents, spouse, children, or grandchildren, when one of them gets sick, I lose my freedom. And that's always the word being free is the one that gets to me. And then most importantly, you know, we're so interested in the work that all of you are doing. It's so important. I mean, I always look forward to the West Virginia Business Summit because we get good updates on everything you're trying to accomplish. But we would really welcome the opportunity to continue to assist the legislation that you're considering, healthcare policy. I know that you often reach out to Mark Poland, Linda Beckman. It's never me because your questions are always so granular. We need a subject matter expert, but we are interested in providing any facts, figures, opinions, whatever you'd like. We're in. So thank you. Questions or, yeah.
Yes, sir, very good, thank you
Yeah.
for being here, not just today for this meeting, but for having us here in Parkersburg this week too.
Yeah.
Questions of any of our committee? Yeah, Dr. Summers?
Are they on already? Yes. Hi, thanks for being here.
Sure.
I like to see the data where it was talking about the number of people on Medicaid, and then I think you had a Medicare chart, but also on the Medicaid, you listed the 618,000. So we got an update this week that our current Medicaid population is 518,000 enrollees. So it will be interesting to see if they go, if those 100,000 go to uninsured or go to other plans. But I feel really encouraged after hearing Jason speak that perhaps people will be working with that population to try to get them on another plan instead of being uninsured. So that was kind of exciting to hear.
It is, that whole redetermination process, which of course everything got put on hold through COVID. We definitely have tracked some that have come into the individual policies. Quite frankly, some of those people ended up on group policies, and I think it'll be good for all of us to figure out where they were. And again, this was the commissioner's report from the 22 market. So like I said, I always wait for them to publish the new ones.
Well, yeah, I saw that for 22, and I thought it would be interesting to see what 25 says, 24
Oh,
and
yeah,
25.
because then you go to the ACA. This is 24. Yeah, this is, not saying all of them came from redeterminations, but that jump from 28,000 to 51,000, I think it's a pretty safe bet that some of them came from Medicaid. And as I said, could be having $0 premiums or premiums under $50 a month for commercial coverage because of the advanced premium tax credits.
Others? Senator Kubo?
Thank you, Mr. Chairman. Thank you, Jim, for both of you for the presentations. Question, when we passed the bill where we bumped PIA for inpatient rates up to 110% of Medicare, has that made any dent in private premiums?
Not a single health system came back and offered to lower the reimbursement rates for us. Now, I live here in Parkersburg. I want WVU Medicine Camden to be healthy. I know I'm in my 60s. I'm hypertensive. According to my BMI, I'm obese. If I have the big one, I want there to be a really good cardiologist down the street. So I care about the financial viability of our systems. So it would be irresponsible for me to say that that wasn't a good and an important change. I would say that in many states, you see other models, and that, that pressure on our three major health systems and everyone else to have to deal with a 75% payer mix is really a challenge. But again, being a Parkersburg resident, it helped. Sure it didn't, but we didn't get any rate reductions.
Thanks.
Others? Dr. Summers?
I thought of one other question,
Sure.
sorry. So when you talked about, what did you call it, Allegheny Health Network? Is that
Yes.
what you called it? Could you describe that to me just a little bit?
Yeah, so our parent company, Highmark Health, We are a sole corporate member. Highmark Health is a not-for-profit company. We're a not-for-profit company. In that umbrella of Highmark Health, there's the Blue Cross Blue Shields in New York, Pennsylvania, Delaware. There's a dental company, there's a stop-loss company, a technology company. They also own Allegheny Health Network. I'm going to give some rough numbers. Nearly 3,000 physicians employed, 13 or 14 hospitals in Western Pennsylvania up into New York. But they, Allegheny General Hospital, the medical provider team behind the Pittsburgh Pirates, if you ever, you're a Pirate fan. It is a large health system in Western Pennsylvania. And as part of our leadership team, when we get together, being an integrated delivery and financing system, it is, I talked about things that I've experienced in my 36 years in this company, like inpatient versus that. Having both clinical leadership along with insurance leadership in the same parent company has really been just a fantastic part of my experience and eye-opening, and probably why I'm not up here pounding the table to say give PEIA reimbursement to our commercial members, because I know that'll bankrupt the health systems, and then I don't have the cardiologist I need when it happens. But yeah, it's a large health system. Again, I think it's 12 or 14 hospitals in Western Pennsylvania.
Do you think that health system has any interest in being in West Virginia?
I don't think so. I can't speak for them, but I talked a lot about how we're structured very clearly, that every dollar that Highmark West Virginia makes stays in West Virginia. Allegheny Health Network is a not-for-profit insurance company or a healthcare provider that came primarily from West Penn Hospital, Allegheny. It was Pittsburgh and Erie. They're very focused on making a difference in the communities they serve. And I really would say West Virginia is not on their market. I mean, they would certainly work with other health systems, but I don't see it coming down this way.
Okay.
And our board wouldn't approve our money to be used to buy a health
Right,
one. So.
right. All right, thank you very much.
But I've learned to never say never in this world, but I don't see it.
All right, other questions or comments from any of our panel today? All right, if not, gentlemen, thank you very much.
Thank you.
Mark, for being here today. With that, we have no other items of business on the agenda. Any other items of business from any of our committee today? We do not. Okay, if not, committee meeting will be adjourned. Thank you very much.